Welcome to ProjectME, the podcast. I'm your host, Tiffany Carter, the founder of ProjectME, multimillionaire entrepreneur, former TV newscaster, money-making expert, female empowerment speaker, and self-proclaimed office supply addict. My mission is to take the mystery out of making big money. Every week on ProjectME, the podcast, I'll share success tips, strategies, and stories from other entrepreneurs, experts, and millionaires, showing you exactly how you can achieve your most exceptional life. Now let's get to it. Exciting announcement for all of my listeners. I've officially opened my exclusive group, the ProjectME Passive Income Posse, to the public. This group is by application only, so we can keep the group high vibe and spend our time, energy, and expertise only helping those of you who truly want massive success and impact. You get live weekly trainings from me, special guest coaches, and direct access to me and my business partner for all of your questions. To learn more and apply, go to projectmewithtiffany.com, click on Work With Me, and select ProjectME Posse. And of course, any questions, feel free to DM me at ProjectME with Tiffany. Welcome to the podcast and posse, ProjectME with Tiffany Carter. I'm your host, Tiffany, and we are going to get you sleeping better today and hopefully decrease some of your stress, or at least get you some answers around why you behave the way you do and why you have some of these symptoms that I know you guys have Googled to no avail, or you've kind of just brushed it off, or you're putting Band-Aids on it, or you attribute it just to like not sleeping well, being a busy mom, being a busy entrepreneur, excess anxiety. But there's actually highly likely an underlying solid reason underneath a lot of these things. So what I've done is I have brought on an excellent and top medical professional in the sleep and stress field, Dr. Christina McGuire. She treats everything from jaw pain, TMJ, sleep disorders, breathing disorders, and a syndrome that I bet a lot of you have not heard of, but you're going to in the upcoming year or two, is the young, fit female syndrome. And we're going to get into this today. So I want to welcome Dr. Christina McGuire, and thank you for coming on during all this crazy times that we have going on.
Hi, Tiffany. Thank you for having me on today.
So first of all, because people right now on the top of their mind, so many people have questions that they wish they could ask a doctor right now, who aren't sick, but just are worried, or they're concerned like, oh my God, do I have the coronavirus? Like, am I coming down with something? And I know that's, infectious disease isn't your specialty, but I know you do treat a lot of patients who have allergies. So
Yes.
Isn't it confusing for patients to tell the difference if they're like coming down with something because they feel so fatigued, or they feel achy, or they have facial pain, and they're not sure, we're kind of paranoid right now. Am I coming down with something? Is it allergies? What's going on?
So I think the biggest difference that you're going to have to note, whether it's, something going on where you have some sort of sickness, illness, or disease, or whether it's more of a chronic or long-term problem, is really how long has it been going on. So if you have sort of this acute or short-term sort of stress response, or, you notice that you haven't been feeling well, sort of in the short term, things that maybe only last a couple of days, possibly a week, then there's probably a more likely chance that that's due to some sort of illness. However, if you've had this issue that's been going on for a very long time, you've chronically woken up with face pain, with jaw pain, you never feel refreshed when you wake up. You've always felt, tired when you wake up in the morning. You've always been a not morning person, things like that. Then that's more of a chronic issue, right? So if it's something that you can sort of attribute to your everyday life, and that's just kind of how you've been living for years and years, then there's chances are something more significant going on possibly with your sleep. But if it's just something that sort of popped up in a few days or a week or so, then that's more likely due to some sort of illness or sort of an acute or short-term problem.
Well, that's really helpful to learn. How many of you guys who are listening right now are like, I never wake up refreshed? Like, is there like a mom or a busy woman that ever really wakes up refreshed? So, can you help us distinguish the difference between just being like busy mom, a busy woman in this world, and like we run ourselves ragged anyway, versus like there's a signal that there could be something more going on?
Yeah, absolutely. So, again, and it goes down into the timing of things. So I get a lot of that. So a lot, I have a full gamut of ages of patients, from moms to kids in high school to teenage, to college age girls to women perimenopausal, postmenopausal. So, kind of the number one thing that everybody wants to attribute, all the problems in their life to is stress, right? That's kind of the number one thing. And unfortunately, it's sort of just become an acceptable excuse for everything as well. So not only is the excuse, but also we're just allowed to say it, and then it's just allowed to be that way. Well, I'm just stressed. And then people are like, yeah, okay, sure. And then we just brush it all off because of this, supposed stress. And again, a lot of this goes down to, is this a new stress, right? So let's just say for somebody who has a lot of clenching or grinding their teeth at night, if it's a short term or like that acute problem that we talked about and it's related to stress, it's only going to happen for a few days. So I remember when you were releasing your course and you had told me, oh, your jaws had been killing you, leading up to that, you had been having difficulty sleeping. But then overall, through most nights of your sleep, that's not the case,
True.
right? So if
That's
it's
true.
something that's related just to like a high stress time or something like that, then yes, you can absolutely say, sure, that can be, stress could cause this, and that could be the underlying cause of it. But again, if it's something that's consistently happening and it's your norm, if it is your norm day in and day out, then that's not really a stress related response. So, kind of the other thing we talk about is, everybody, again, we blame stress for everything. My job stresses me out, my kids stress me out, all this, that, and the next thing. But then the question comes, do you still have this issue on the weekend? Or do you still have this issue, if you go on vacation? Is it still a problem? Because if it is still a problem and you're still, you go on vacation and you still kind of wake up, you don't feel refreshed, things like that, then there's probably something underlying going on. But, if not, and, on the weekend you feel better, you can sleep in later, you get refreshed, your kids don't bother you as much, you're not as volatile, you're not as emotional, and all these sorts of things, then that kind of differentiates if it's just that short-term stress response or if it's something more serious going on.
I mean, you bring up such a great fucking point, you guys. I mean, the fact that we've made stress acceptable, and it's also kind of like a weird badge of honor that women wear. And I mean, I'm guilty of it too, where I'm very mindful of my words because I do a lot of work around that. But, I hear I'm so stressed, I'm so busy, I'm so exhausted. And when we say these things over and over again, they become normal. And then we just kind of brush off like, well, of course like my, every muscle in my body is achy because I'm stressed. Of course I'm tired in the morning. Of course I don't want to get up. Of course I press snooze a million times because I'm stressed. And then we don't dive any deeper. It's like, why? We're not meant to fucking have to live that way. So how the hell did this become so acceptable, especially to women? Like if a man felt the symptoms of the women that you treat, not that you don't treat men too, but like if most men felt the symptoms that the women are coming and complaining of, I think those guys would seek medical attention way faster than a woman does.
Absolutely. And typically, again, to bring up the difference between men and women, the way they present with some of these sleep disorders or even the way they deal with psychological and stress is so very different, right? So it's kind of, when we're talking about even some of this young fit female syndrome that we're talking about, women who have it aren't necessarily sleepy, so to speak. They're fatigued, they have anxiety, they have depression, and those tend to be the chief complaints that we see in people in this. Whereas most men who tend to fall in that, category of sleep apnea or something like that, they're just tired, right? They're sleepy. And it doesn't change. So there's different mechanisms for how each of these occur. And it's not that one is less taxing or less on the immune system or the body than the other. They both have their own, very serious consequences of them, but it's just that they present so differently, and I will say, we just allow this answer of stress just to be, right? And of course, stress does have a very profound effect on our body. And you've talked about it. It has a profound effect on our nervous system. It has a profound effect on certain, hormones that get released, cortisol, being one of them. Our sympathetic nervous system, or that fight or flight, is now in overdrive all the time. And yes, that does have a place for us, evolutionarily. Like, we do need to have a decent, some amount of stress in order to properly survive. That is, an integral part of survival, but we have just completely lost our ability to manage this. And again, I think, like you said, it's a badge of honor for one, but also it's kind of, even in the medical profession, we just kind of attribute it, oh, you're just stressed, right? Because a lot of times we didn't have good answers for people. So that's an easy kind of good answer for people, right? Oh, it's just stress. Oh, you have 3 kids. I mean, I can't tell you how many moms come in and they're like, well, I talked to my doctor about it, and they're like, well, that's just what happens when you have 3 kids. And it's not true. That's not just, we don't just accept that and move on. Most of these people know something's wrong, but they've just kind of been brushed off, right? No, you're fine. You don't have heart disease. You don't have this and the next thing. You're healthy. All your levels come back good. You're fine. And then you're like, then explain to me why I feel like I can barely get moving every morning. Somebody please help explain that to me then.
Yeah. And then it brings up a feeling of like hopelessness, or I guess this is just how I am. Or like we were joking earlier, which is so funny because didn't I post this? I did post this yesterday, you guys, in my Instagram stories at ProjectME with Tiffany. I posted that I've never been, I'm laughing because when we get into this whole young fit female syndrome, you guys who've been listening to this show for a long time and who follow me, you're just going to start laughing because I'm like, I'm like the classic patient. And I'm laughing because it's everything you're saying is so true. But I posted in my stories that I've never been a morning person, even as a child. Now, the fact that I even have that line, that phrase I say, you mentioned that, it's like, I have that phrase because I just thought, well, I've never been a morning person. That must be why my entire life, I mean, even as a kid, I had to be woken up on Christmas morning. I mean, that's not fucking normal. Okay. And I love Legos and Barbies. Like, I knew there was good shit under that tree. And I was an only child, so I at least got some good shit, even though the household was a mess. But I still had to be woken up. And even when I went to start, wanted to be an entrepreneur when I was, in my full-time career, people who knew me, because I taught them by them knowing me and me saying it all the time, said, how in the hell are you going to be a successful entrepreneur when you can barely get up in the morning? Because successful people, like the early bird catches the worm and all of this stuff. And I had a lot of shame around the fact that I could not get up early, even in the corporate world, because like I come from the medical side of things, not as a practitioner, but on medical device companies, pharmaceutical companies, on that side, it's male dominated. And let me tell you guys something. These meetings, they can start at 6 a.m. and these men are wide fucking awake. And there'd be like me and maybe one other female. And I can tell you right now, I knew I was the only person that had difficulty being able to like mentally get my shit together. So you know what I did, right? Caffeinate. Mm-hmm. Let's just be really honest what else I did. Well, because it is my show. So let's do the list. I'm trying to think, because I obviously have, access to pretty much any drug I want. So when Provigil came out, I don't remember the generic name of it, but when Provigil. So when Provigil came out, like you guys, it's indicated for narcolepsy, just saying. Provigil came out. I did that. I did Adderall, right? To get that bump. So do a lot of people. In fact, there's an epidemic of housewives that do meth, you guys. You can Google that shit. And I think it's because of this whole young, fit female syndrome. I know I went off on a tangent, but I need you to like tell me this whole morning thing. is it bullshit, or is there some truth to it? What's happening?
So there's kind of a couple things that came up for me when you were talking about that. So I'm going to try to remember all the things
that I
talk about, but if I forget, I'm sure we'll get to it a little bit later on. So, the first thing and the first point that I kind of made to you yesterday when we were, off your post about, I've never been a morning person, is that whole you need to get up early in order to be productive, and everybody needs to wake up at 5 a.m. if you want to, rule the world, early bird gets the worm. That's all just complete and utter nonsense. And like you said, all it does is perpetuate this shame feeling that people have about not being able to be a morning person. And the truth of the matter, the truth of the situation is that we all have our own very unique circadian rhythm and our circadian clock. Right? So I don't know if you've ever heard of the circadian clock or the circadian rhythm, Tiff, but so basically what that is, every single animal on the face of this planet that sees the sun, rise in the morning and fall in the evening has some sort of internal clock, 24-hour circadian clock. And so for humans, since we're largely, we are largely based on light dark circles, right? We like to be more active in the day and we sleep in the nighttime. One of the major things for us is daylight. And that's kind of what gets us to wake up in the morning. But everybody's different. So it's not just like the sun rises and we all feel like we need to wake up. Our circadian clock is as ingrained in your DNA as your hair or eye color. So it is something that is a part of you, and it is something that, yes, technically you can change, but it's not just as easy as, oh, I'm going to set the clock for 5 a.m. tomorrow and I'm somehow just going to change my circadian clock. So some people, their natural circadian rhythms, let's say they're like 11 p.m. to 7 a.m., right? And that's just naturally how their body feels. They need to, that is their awake and sleep cycles. Some other people, it's a little bit earlier. Some people are a little bit later. And that's kind of where you come into these early birds, these night owls and things like that. And not one group is better or more productive than the other. So, following your own circadian clock, light and dark cycles as well, it's also going to tell you your ideal times for eating, your ideal times for exercise, your ideal times for, how your temperature gets rated, so on and so forth. So there's a lot of things that go into our own circadian rhythms. And, again, you're going to be less productive if you're trying to fight against your natural circadian rhythm. So if your body can never fall asleep until 11 o'clock, but you're trying to force yourself awake at 5 a.m., now you're just sleep deprived, right? So now you've just deprived yourself of this sleep that you actually need in order to function properly and at your best. And so your whole day is going to be spent being less productive and less efficient with your time. And I know that's kind of something, and that's kind of why I love you. It's this whole hustle grind and you need to work more hours in order to get more done. That's just nonsense. And this kind of goes along with that whole perpetuating thing that, unfortunately society has sort of claimed is, you need to work more hours in a day, being able to get more done in order to be, a more efficient, productive human being. And no, if you're fighting your natural circadian clock day in and day out, then you are going to be constantly depriving yourself of the adequate rest and sleep that you need, which means your concentration is going to continue to get worse and worse over time, which there's a lot of, things we'll even talk about when we talk about this young fit female syndrome. But concentration, learning, memory, all these things are so significantly reduced when we aren't getting our adequate sleep. So,
is that like brain fog? Like if a lot of people I hear, like a lot of my clients will be like, I just can't, I can't find my words, or like, I forget even how to spell a simple word, or I have no idea where I put my keys. And they even think some women, even depending on their age, start going, I had an incident like this when I was really, really sick, where I was like, I'm having early stage dementia. That is how much I was thought I was losing my mind.
Absolutely. So that is all sort of related to sleep deprivation, right? So it's called these lapses in concentration. You get this brain fog, you get these things called these micro sleeps that are occurring all throughout the day. And it's just kind of where your brain isn't really able to properly function. And I know, again, this is something we've talked about in the past, and probably one of the things that sort of frightens my patients the most. You brought up that, what you thought you had early onset dementia, but there is actually a very good association between lack of sleep or sleep deprivation and Alzheimer's disease, right? because of these plaques that build up in the brain, because you're not allowing your body to get into those restful restorative sleep stages at night and kind of clear these toxic metabolites out of your body, you run the risk for a lot of these issues of difficulty concentrating, again, Alzheimer's. And there's a lot of other things, that we're going to talk about that kind of can happen, downstream if you do chronically deprive your sleep. But absolutely, that brain fog, that feeling of, you can't remember anything, that's all related to sleep deprivation or a lack of sleep. And again, if you're one of those people that keeps trying to push your circadian rhythm back and forth, depending, then you're sleep depriving yourself.
It goes back to like accepting. It sounds like it goes to acceptance, which is what I love how you practice medicine, because she incorporates, it's not just even so much like you do Eastern, Western medicine, because that's kind of become cliche. You really go deeper in that when it comes to working with people on stress. It's also self-acceptance is what it sounds like. Like it's so validating to hear this from you. Like, this is just in your fucking DNA. This is who you are. And come to acceptance and work with what you've got. Just like I'm the height that I am, right? Work with what I've got. I have certain gifts, work with what I've got. Now, with that being said, is there a way for someone to be able to tell what their natural circadian rhythm is? Like, is there a way to experiment to get an idea of what those hours are?
That's a great question. And it's actually sort of, since we're sort of in this quarantine, time that we're all in, a lot of us aren't able to go to work or offices or things like that. Maybe more people are working from home or whatever that may be. It's actually a pretty unique time where it's actually a kind of a great time that we can all sort of figure out our own natural circadian rhythm, our own natural circadian clock. So, what you do for that, originally they call it like the Hawaii experiment, right? So like, what is the Hawaii experiment? Imagine you could spend a week or two in Hawaii. You had no obligations. You had no sort of stressors. You could wake up when you wanted to. You could fall asleep when you wanted to. And you sort of start to figure out the pattern of that as it happens, over time, right? So let's say, again, calling it Hawaii, obviously none of us are going to Hawaii right now, but, we sort of have more of this fluidity in our schedule right now, which I think is a really good time for us all to sort of figure out what is our natural circadian rhythm. So it's exactly like I say, you allow yourself to naturally, drift into sleep at nighttime when you're tired. And again, that doesn't mean staying up watching TV all night, until you feel so, exhausted that you need to go kind of pass out. It's still paying attention to these sleep hygiene things like no bright screens before beds and stuff like that. But it's allowing yourself to naturally wake up when you feel like it as well. You don't set the alarm, and some of you might be so sleep deprived that you might be sleeping a little bit longer.
I just made like, the emoji face where you like clench your teeth, because the whole time I'm going, girl, anyone who's close to me, if I didn't have an alarm, I'm not fucking kidding you. And this has been my whole life. If I didn't have an alarm, depending on how like deep of a sleep I'm in, for sure, I will sleep a solid 10 hours. Is there a number of hours that you think is the sweet spot?
So, that 7 to 9 hours is really, the kind of place where everybody should be. So I know we've all kind of seen those recommendations, but we all, most of us also think that we can get by on 6 or 7 or less than that. But the truth is, you really can't, and yes, there is like a minuscule, almost a 0% percent of the population that actually can get by in less than that recommended 7 to 9 hours of sleep. So assume you are not that person. If anybody, whoever's listening, you are not that person. Let me just tell you, because the percentage of that is like 0. So
I do hear a lot of people who are super type A and a lot of males. They're like, well, I don't require much sleep. I just require, 5 or 6 hours. And I've actually been envious of those people my entire life. I'm like, I could be so much more productive, but that's not healthy, is it?
It's not. And I used to be one of those people too. So I'm right there with that group of people, right? I was like, I can get by on 4 to 6 hours of sleep a night and I'm fine. And the truth is that, again, when it comes to these lapses in concentration and all of these other things that are happening when you have chronic sleep deprivation, it's still happening to these people who can get by on 5 to 6 hours or whatever it is that they think they can continue to deprive themselves of. But it's just, it's like I say, either it's the death of a thousand cuts, right? And so it's every single day that you do this, and every single morning you wake up, and then your ability to concentrate, focus, all of these sorts of things are just decreasing day by day by day by day by day by day.
It's like a compound effect.
Right. So you're lowering the bar every single day that you're doing this. The problem is you just acclimate to that new level of decreased productivity, decreased concentration, and things like that. Yes, can you survive? Sure. You know what I mean? Is it going to ultimately cut your life a bit shorter? Probably. You know what I mean? Like in the grand scheme of things, right? Can you get by? Can you still do things and work? Of course you can, but you're never going to be operating at your optimum level if you're only operating on 5 or 6 hours. And they've done a lot of research studies and things like that they've done in laboratories with people where they've just deprived their sleep, and everybody thinks they are doing just fine. Everybody thinks that they are, being at their optimum levels of, concentration and productivity. And when they actually measure it, when you get a full night's sleep and when you're chronically sleep deprived, you can see you get a significant, almost a 400% increase in these decreases of concentration when you continue to disrupt your sleep night over night over night. So,
and it's like when you see people like that show that I'm recently obsessed with, and I watch it while eating because it's a great diet trick, but like the 600-pound life or whatever it is. And I know that's food addiction, but where I'm going with this analogy is what I say a million times when watching it. And I know you guys too say this when you're probably watching shows like that. How did someone let it get this bad? First off, we know it's an addiction, but also, or it's like, how can someone carry that much weight around? Like, even if I'm carrying around, even an extra 15 pounds, I can feel it. Because like you said, if you don't gain 15 pounds, 100 pounds overnight, it becomes your new normal. It creeps up on you. So it becomes part of your story. And I'm going to call out my fiance right now. So your ass better be listening. His story is, and he has used this for well before I met him, is I'm a forgetful person. I just forget everything. I'm telling you, this is his story. And he is like the absent-minded professor. It's not cute. He tries to make it cute. It's not cute. It's like a contention in our relationship. But genuinely, I do have some compassion because he doesn't just forget things for me. He forgets shit that's like, I know is important to him, and he feels horrible about it. I think, listen to me playing doctor, but I see that as it could potentially be a compound effect of lack of sleep.
Absolutely. Absolutely. And we see this in a lot of people, and it's, unfortunately, are you going to be able to regain all of the mental capacities that you've lost over, however many years, let's say 10 to 20 years since, because most of these people, right, it starts when you start working and all of a sudden you get this increased workload and, all sorts of things like that. And then you just continue to do it. So 10 to 20 years of that amount of sleep deprivation, takes a toll on your brain, right? So lack of sleep takes a toll on the body. It takes a big toll on the brain, and you compound that over all those many years. And yeah, you're going to start to be that forgetful person, right? And I bet you if he thought back to when he was a kid, probably, wasn't like that. But absolutely, it's the sort of compound effect of things that happens over a long period of time.
The psychology behind what you do and the patients you treat is what I find so fascinating, because in a sense, you're also being like a psychiatrist in a way, or a psychotherapist, right? In a way, because you're having to ask you have to really read between the lines with people and ask them a lot of questions in a lot of different ways, because so many of us, I'm lumping myself in here. I mean, look at the story I created. I'm not a morning person. It's like, well, I'm not, and I can accept my circadian rhythm, but I know that we're going to get into, there's more to the story than that. But like, like Mike saying he's forgetful, or there's a lot of women who say, well, I still have pregnancy brain, even though I gave birth 6 years ago. Right. And we come up with these stories. And when we come up with these stories, we're just ending up living a less vibrant, less satisfying, less productive, less happy life. And we're accepting that with those stories. And you really have to kind of counsel people on that too, don't you?
Absolutely. That's a big part of it is, making sure they kind of understand. But I think more than that, it's when I'm able to elucidate or highlight something that may be going on with them physiologically in their body, there's sort of a sense of relief that people get from that as well, right? So they are a little bit more willing to accept that when I can, look at an image or, show them that your airway should be this big, it's this big. I'm, showing one that's really big and one that's really small, and when they can kind of visualize and see how some of these things have come together for them, they can really accept that something deeper, might be going on. But yeah, like you've said, as well, one of the big important factors of sleep as well is our emotional states of being are kind of kept in check. And when we are lacking in sleep, you get these huge pendulum swings on either end of the spectrum, either very sad or very happy and things like that. So yes, those of course are the people that I'm treating as well. They are on these very extreme ends of the emotional spectrum because the lack of sleep is also going to significantly affect our emotional states. So sure, there's a lot of time people come in kind of arms crossed, like, what are you going to do for me? Sort of, things like that.
Totally like, that's how I would be like, okay. Like probably also because other people have brushed a lot of your patients off before saying, oh, well, welcome to life. Right.
Right. Absolutely.
Let's get into this young, fit female syndrome. And I know so many of you are listening are like, oh my God, I want to know what that is all about, because there's a lot of assumptions we make as non-healthcare professionals, although I have a lot of healthcare professionals who listen to the show, or you're a healthcare professional, but it's not your specialty. We make these assumptions based on certain characteristics of people. Like there's one I have where only people who really snore and have sleep apnea are obese. I'm not a fucking doctor. I don't do what you do, but I've come up with that. Like the only people who have a breathing issue that affects their sleep is someone who is overweight or they have like a deformity. And that's just bullshit, isn't it?
It's actually perfect that you brought that up, because that is what I try to tell people about all the time. There is that, that kind of that Pickwickian Joe the fat boy, sort of model. This big overweight man is what everybody has in mind when they think, oh, that's somebody who has a sleep disorder. They can't breathe right. They have sleep apnea. And that is so far from the truth. Right. So you see me, I'm not a big fat man. Right. And so I have a sleep breathing disorder. So I have this young fit female syndrome that falls into this umbrella of sleep apnea. Right. And most of my patients, the 90% of my patients, are also not big, fat, overweight men. They are women, young women in their 20s, also older women, but they're fit, they take care of themselves. They're not obese. And as it turns out, only about 30% of people who have sleep apnea or one of these sleep breathing disorders actually has some sort of anatomical impairment like obesity or something like that.
Oh, really? It's only 30%.
Only 30%. So it's more likely that there's something else going on than obesity that's causing your, sleep apnea. Albeit if you are obese, that significantly increases your risks. So, if that's an issue, that's obviously going to be a part of it, but there's so much more that happens, with our breathing at nighttime that is not just obesity.
So what are some of the telltale symptoms of young fit female syndrome?
So, for those of who are listening, who are from the medical community, so it's not technically called young fit female syndrome, right? But it is a good way for us to kind of describe the patient population. So it's actually called upper airway resistance syndrome. If somebody decides they want to Google it, in the meantime as well. But this young
which everyone's like going to promptly do after this. Go ahead.
So what do we see in a lot of these patients with this young fit female syndrome? So here are some of the most common symptoms we see with people. Difficulty falling asleep, a difficulty staying asleep. So that's kind of insomnia, right? Restless sleep, you're tossing and turning all night long, unrefreshing sleep. So again, you wake up, you don't feel well rested. You kind of feel like you never went to sleep in the first place. Fatigue. And I say fatigue versus sleepiness or tiredness because that feeling of fatigue is very different than just feeling tired, right? A fatigue is kind of like that generalized full body sort of feeling, okay? Also excessive daytime sleepiness. I'm talking like you're going to the doctor because you're like, there has got to be something wrong with me. I am so tired throughout the daytime. There's no way that there's nothing going on, right? That kind of sleepiness. Anxiety, mood disorders, depression, things like that can come from somebody who has this young fit female syndrome. Headaches, acid indigestion, so GERD, and IBS or GI issues. And for a lot of my patients, that seems to really click for them because they're like, oh yeah, I have a lot of GI issues.
Really? Why would having like IBS, diarrhea, constipation, bloating, all that stuff that goes with IBS, why would that be a symptom of a breathing issue while sleeping?
So there's kind of a lot of different, factors to it. So of all these things, there's not just one simple answer to any of them, but kind of one of these biggest reason that you're going to see an increase in GI issues with people who have this young fit female syndrome is because when you're chronically sleep deprived or you have these frequent arousals during the nighttime, which we'll talk about, that's typically what happens in these patients with the young fit female syndrome, is it causes your sympathetic nervous system to basically go into overdrive. So if you guys don't know what the sympathetic nervous system is, it's that fight or flight, right? So again, that fight or flight system is good for us in small doses, but when we have these frequent arousals throughout the nighttime, that's occurring when we have this young fit female syndrome because all of a sudden our throat notices that the air coming into it isn't so sufficient. So
like your brain's like, I'm suffocating.
Exactly. So your brain kind of freaks out. And that tends to happen with it's called respiratory effort related arousals. And we tend to see this more in this group of people with young fit female syndrome. And that's basically exactly what happens. You get this minor change in your airway diameter and your brain just freaks out. And it's like, oh my God, we're going to die. Exactly. We're suffocating. And it wakes you up. And if you guys could see, I'm quoting wakes you up because a lot of times, yes, it means your eyes open and you actually recognize that you're awake. But a lot of times also, you're not going to remember being awake. So when we looked at it on sleep tests and things like that, we see these people wake up, 15 plus times a night. They don't obviously remember that, but then they're like, why am I so tired all the time? It's because they have these frequent arousals. So going back to how does that cause GI issues? Again, that's an uptick in that sympathetic nervous system, right? So every single time you have an arousal while you're sleeping, if you're conscious of it or not conscious of it, but basically if your brain goes from that deep sleep level to like an aroused or awakened level, you get this stress response in your body because your body sees that as stress, right? So with stress, we've awoken. So what happens? You get this uptick in cortisol. Every time you have one of these arousals, you get a burst of cortisol inside your body, right? Mm-hmm. So all of a sudden now you have this increased cortisol all night long, right? And so this is occurring night after night after night after night. So you have all this cortisol that's pumping through your body all night long when you're supposed to be resting, and there should really be
when your cortisol is supposed to be at its lowest state is when Correct. You're sleeping. The highest is when you wake up in the morning.
Exactly.
Oh my God.
But then all night long, without you even realizing it, you've been getting these hits of cortisol all night long, right? So cortisol in and of itself has a lot of damaging effects, right? So cortisol does what? We have increased in the levels of cortisol. We're going to get an increase in oxidative stress or what we call free radicals, things like that in the body that increases inflammation in your body. When you have extra oxidative stress, all of a sudden now you have all of this inflammation in your body. And then it's systemic inflammation, right? Add on top of that, if you're somebody who has pain or something like that, and you have inflammation coming from all these different areas, now you have all this inflammation, right, in the body. And that's that's one of the ways that we can get GI issues with people. So we get this hit of cortisol, we get this increase in oxidative stress. Now we have increased inflammation in the body. And that's kind of another reason why we get headaches, right? So people, when they wake up with headaches in the morning, why is that? Because they have so much inflammation in their body because they haven't slept at all the night before, right? They've just been hit with cortisol all night long. And then the other reason that you tend to have GI issues when you have this young fit female syndrome, or when you have all these arousals at nighttime, is because, again, your sympathetic nervous system gets ticked up. And what happens when we're in the fight or flight response? Blood is going to go to certain places of our body that are going to help us either fight or, run, right? So, and where that isn't going to be is your digestive tract, right? So when you need to run away from a bear, or, hide or do something because there's a horrible stressor that's happening to your body is not going to focus on, well, I better digest this hamburger I just ate, right? Like, so the blood flow goes from the stomach to, like your arms and your legs and all these big muscle groups, so you can run away from something, right? So now you don't have adequate blood flow. So it's not getting the signal into the stomach to say it's time to digest. So then you end up with a lot of undigested, putrefied mass of foods, in your stomach and your GI tract.
Wow. This is absolutely fascinating and also scary, which I knew it was going to be. You know what's funny, you guys? I slept like shit last night, like the worst I've slept in a long time. And I mean, I've been up, for me to say I've been up since 4 a.m.
Oh, wow.
Like wide awake. And I'm like, damn it, this is your fault because I was interviewing you today. And I was like, then God is saying, like, I made it so you didn't sleep, so you can hear what she has to say even more. So you'll actually take action and get the help you need for your young fit female syndrome. Now, I know a lot of women listening are going, okay, I can relate to a lot of those symptoms. I'm like, I wake up feeling puffy, groggy, bloated, I can't poop, all these things. They can relate. Like, I'm foggy in the brain, I might have jaw pain, but I don't snore. So this can't be me. Do you have to snore to qualify in this arena?
Absolutely not. Most of the time you probably are going to see it in patients, but it is no. So it doesn't matter if you snore, if you don't snore, if you're a quiet breather, if you're not a quiet breather. That's not going to tell you that you do or do not have this issue going on. With sleep apnea, like specific sleep apnea, yes, you're probably going to see more snoring in that population, but this population, not so much. And it's not because the airway completely closes off with this, right? It's because it sort of closes off, right? So if I talk about somebody with apnea, that means there's almost complete closure of the airway. We talk about somebody with upper airway resistance, right? That means the upper airway, so like this part from like the nose to like the trachea here, that when you have resistance, that means there's a reduced amount of airflow. It's like constricting. It's constricting. So there's less airflow. It's not that there's no airflow, there's less airflow.
But like constricting, when you guys think about it, you're being fucking slowly strangled multiple times a night. No wonder that would trigger your nervous system for like danger, mm-hmm. Right? And then you wake up feeling like you've never slept because you really never have.
Right. And we see, so, there's sleep stages, right? And we're not obviously going to get into what sleep stages are, but there's light sleep, right? There's deep sleep, and there's like REM sleep, essentially. So what we see in our patients when we get them tested for their sleep to actually figure out, is this really going on? They never get into that deep sleep, or really even a lot of times into REM sleep. They're sort of in this light sleep stage all night long. And that's why they're like, I sleep 9 hours a night. And it's like, not really. Your eyes are closed and you're sort of unconscious for 9 hours a night, but your brain isn't actually sleeping because you're arousing so many times throughout the night that you actually haven't gotten any good quality sleep at all. Yes, you could sleep 17 hours a day and you'd probably still feel the same because your brain isn't actually going into those deep sleep stages.
Which is why, I say, wow, what another story, you guys, I say, I don't know who can relate to this, but I'll go, well, I require more sleep than most people. I need like 9 to 10 hours. Well, maybe I need 9 to 10, or I think I need 9 to 10. It's because for me to get 5 hours, I need to be asleep for 9 to 10, like 5 quality hours. I need 9 to 10 because of this condition. So it's another story. And I want to touch on this because I, you guys know back in the day, I sold drugs, but like legally, of course. I was in the pharmaceutical industry when Ambien came out. I have lots of very fascinating Ambien stories. I've done lots of things on Ambien. Always make
You're not alone.
Always make sure that you go straight to bed if you are to take any of those meds. Now that's like I think it's actually like there's a black box warning about it. Anyway.
There's a website about the crazy things people have done on Ambien.
I've like bought some weird shit on infomercials, like who ordered this? Someone stole my credit card, but it was me. Anyway. So a lot of people use Band-Aids for these symptoms because there aren't enough people like you where they've not had access to people like you. There's not been enough public attention on this yet. You know, I know you're changing that, which I so appreciate. And so what people do is use Band-Aids. They use caffeine. They use street drugs. Let's be frank. Listen, I know a lot of housewives. I know a lot of celebrities and it's not like they want to use it. They're using it to function. I know a lot of people that do cocaine bumps in order to function because Adderall doesn't work anymore. They use Ambien. They use NyQuil, right? They use Tylenol PM or whatever. Like I have a couple friends. One friend just said to me, actually, I really needed a good night's sleep. So I took a Tylenol PM. Wouldn't you say if you're kind of dependent on some of these substances, that is a pretty strong clue you could have this young fit female syndrome?
Yeah, I think it's short-sighted and irresponsible for any professional to prescribe pills like Ambien or anything like that without actually fully investigating what's going on with somebody's sleep. It always surprises me, and it actually shouldn't surprise me anymore, but I guess it just shocks me, I should say, more than anything. When I get patients come in, they're coming in for sleep, and I've been on Ambien or sleeping medicine for 10 years. Well, why did you get on it in the first place? I don't know. I went and told my doctor I was having trouble sleeping. Well, did they do a sleep test or anything on you? They look at me like, well, no. And I'm like, well, how are they treating you for a disorder when we don't actually know what the disorder is, right? So if you had something like sleep apnea and you're masking it with Ambien or any of these other things, you're still not actually treating the disorder. So you still have all these increased risks of heart disease and Alzheimer's, anxiety, depression, cancer, diabetes, all these increased risk of things that come with sleep deprivation just because Ambien makes you sort of shut your eyes at night, or Tylenol PM makes you able to better shut your eyes at night. It doesn't mean you're actually, again, getting that good quality sleep that you need to be getting.
Because it's not like that drug's keeping your airway from constricting.
Exactly. And that's exactly the thing. So when these people have, again, one of my patients, and we actually sent her to the sleep surgeon because I was like, I'm not quite so sure, what we need to do here. And because she had been prescribed Adderall because she was so chronically tired during the day that they thought, maybe she has narcolepsy. And it's the same thing. And I said, did they test you for narcolepsy? And she's like, no. And I'm like, okay, so now you're getting an amphetamine, right? So that you can use.
You're getting
legally.
Speed. Yeah.
Mm-hmm. Yeah. And nobody ever thought to say, let's actually figure out, what's going on there. And, in defense of, I suppose, physicians and things like that, sleep is still a very newer science and, a newer medicine. As it would be. But still, I think now if we're still kind of prescribing sleeping aids and things like that without actually fully identifying what the problem is, then, we could be doing a lot of harm for people.
Isn't that crazy that she just said like sleeping is like a newer science to be studied? Last time I fucking checked, we've been sleeping since we were cave people. It's like you would think this would be the most wildly intensely studied thing that we do, like breathing and sleeping.
Yeah, they didn't even discover sleep apnea until the late 70s.
That's crazy. That's absolutely wild to me. So
they used to treat it was by doing tracheostomies on people.
Oh my God, you're kidding me. Oh, how violent. Wow, that's crazy. I mean, I've definitely thought of doing that to Mike in the middle of the night. How many women, by the way, are like, oh my God, I have I have definitely had that thought. If you guys are loving this episode, finding it fascinating, entertaining, all the things, take a screenshot right now, share it on social media, tag me at Project Me with Tiffany, tag Dr. Christina McGuire at Dr. Dr. Christina McGuire. And if you're driving, multitasking, or you're sleep deprived and can't remember, just tag me at Project Me with Tiffany, and then I'll make sure to tag Dr. Christina as well. It'd really help us know, by sharing that. And it's also going to help other women, right? And other people in your life by sharing this episode. I'm sure there's so many of you who are validated right now, who are feeling, oh my God, okay, there is a reason for this. Like, I'm not supposed to have to live my life like a zombie. Like, I'm meant to have a better quality of life than this. And there's actually more to it. I know for a fact you guys are super validated, because I know I am. So for the women who are listening, and men, I'm sorry if I'm ignoring you men, that are like, okay, now what? Like, I have a lot of these, I have a lot of these symptoms, doctor. Like, what can they do? Is there some kind of like an evaluation or a consult or something they can book with you to kind of determine if this is in fact highly likely their issue?
Yeah, absolutely. So we are doing virtual. So we do virtual consultations. And so what we'll do with that is we'll kind of take a deeper dive. So we send you a very thorough questionnaire, medical history that we would ask you to sort of fill out. And then we will get on I will actually get on with you and sort of talk through some of these issues, and we can determine if we think that there is some sort of deeper underlying cause to what's actually going on for you. So, and then of course, answer any questions and things like that you would have along the way as well. But it's a really good way, like you said, to sort of validate, yourself as well, if you really do think that something is going on. And then we can make sure we get you sent to the appropriate place if we do think some more evaluation needs to be done.
Yeah, and this is also not just for you, but if it is a significant other, and I know and I want you to share how common this is, because this was really interesting to me. You treat a lot of like college age girls, and you said there's something hormonally that there's a reason why breathing issues and jaw pain and all these symptoms can really highly present themselves at certain times in a woman's life.
Yeah, so I will say probably what most people would find even more shocking is, besides just 19, 20, teenage, girls, is young kids. So we're finding that there is a significant population, I'm talking little kids, right, who have sleep apnea and who have these sleep disorders. And kind of the really frightening thing that we see in the pediatric population or in young kids is they're getting these improper diagnoses of things like ADHD. They have all of these behavioral issues. Now they have these learning disabilities and things like that. And, if you kind of figure out what's going on with a kid when they're young, our brains are developing so rapidly at this age. And again, if your brain cannot get into those deep sleep stages, then you're going to end up with all of these sorts of issues. So there's a lot of studies that have kind of shown that children, and I'm talking, young kids too, so 3, 4, 5, up to adolescents, are getting misdiagnosed with things like ADHD, and again, being put on medication for it because they have all the symptoms there, when it turns out they have a sleep disorder, an underlying sleep disorder.
Oh my God.
You correct the sleep disorder in these kids, and then you're actually able to allow them to sleep, and it corrects all these other symptoms that you had seen, in these children. So I would say, if anything, that's probably the more alarming one. So I would say even too, if you're a woman and you have children and you have this issue, we know there is a genetic component
Isn't
to
this fun?
disorders. So, if your kid is, of an older age, 2, 3, 4, and they're still waking up during the night, that's kind of a little bit of a cause of alarm. And I will say, you had brought up snoring for this population of young fit females, and that's not always an indication. I will say the one thing, if you get away from this for your children, is if they do snore, you should absolutely push for them to get a sleep evaluation, because there is such a high correlation between sleep apnea and snoring in children. They're actually required by the American Medical Association. That is a a statement that they put out actually quite a few years ago at this point, that if a child does snore, it is an automatic indication that they need a full sleep workup.
Oh my God. There is no way all you guys there. I would be shocked how many of you moms out there knew that. That's crazy.
Mm-hmm.
Wow. And like, so what, touch on what you were saying to me hormonally. There's a hormonal component to where this can be exacerbated or something at certain times of your life.
So we were talking about the pain pattern that tends to affect some of these 18, 19-year-olds, that tend to come in for me more so with jaw pain and pain issues and things like that, because of the estrogen receptors on the joint there. They can tend to have an increase in pain patterning around that age group. And then on the opposite spectrum, so now we're talking about people around menopause, so peri or postmenopausal women, what seems to happen there is throughout women's adulthood, right, lifetime, men tend to still have a higher risk for, let's just say, sleep apnea, because that's really where the higher risk exists for men. But as menopause occurs, women actually reach that same risk factor for sleep disorders that men do because of the hormonal shifts that are occurring.
Wow. I mean, this was so much of this was mind blowing to me. And I've already had a little more knowledge than probably some of you just from all of our talks. So you guys take a screenshot. I want you to share this. I want as many women as possible to hear this episode. Take a screenshot, tag me at ProjectME with Tiffany, tag Dr. Christina McGuire at Dr. Dr. Christina McGuire, and share it on social media, because I mean, I would imagine, I actually don't know any woman in my life who's like, I'm just like happy and energized upon waking. Are you?
Yeah, well, because I had this and I got it treated.
Oh, okay. Well, let's end on that. Tell us what it looks like on the other side of being compliant and actually doing the treatments and taking care of it. What is the difference?
And again, when I say that initially, when you are so chronically sleep deprived that you don't even realize how bad off you are and how low you have set the bar for yourself, I didn't realize how poorly I was performing and how terrible I felt until I started to feel better. So it's like you wake up in the morning and you're able to just open your eyes and kick the sheets off of you, right? And get up and get your day going. It's not like you need to slowly walk your way into the kitchen and just barely able to lift your arm or open your eyes to make yourself coffee anymore. I could get up and exist in my day and, do the things I need to do. I wake up with energy, but I also make sure I pay attention to the things that are happening at nighttime, no bright lights, no TVs, things like that, making sure I'm falling asleep when I need to. But my energy levels are where, they should be of, a woman my age, which is fairly high. I have, young kids and I'm able to have the energy to play with them and to hang out with them and, to do things. My work days are so much easier because it doesn't take me 7 hours to do something that could have taken me 4 if I just had the ability to concentrate a little bit more, so it's all factors of life tend to improve when you get these sort of things fixed. And it's not just that sleepiness feeling, but it's, your ability to, your whole quality of life just improves, and, weight as well. So you're probably going to drop weight a lot easier because there's a big correlation between lack of sleep or sleep deprivation and issues with the weight, things like that. And so, it's good. And again, this is how I got into it because this is who I was. I was this young, fit female patient. I walked away with more questions than answers when I went to talk to doctors in different medical specialties, whomever it was about it. And I was just like, there's gotta be something else going on here. And I think for most of, my patients and people, you guys all know something else is going on, right? There's something under the surface. It's just trying to get somebody to also know that with you who is in a position to help you, right? So some sort of medical professional. So the other side of it is beautiful. It's amazing to feel the kind of energy and zest for life that I'm able to feel now.
Oh my God. I think I'm finally sold. It's only taken me 2.5 months. I'm such a pain in the ass. I'm so stubborn. So what is the website that people can go to in order to book a virtual consult evaluation with you?
So our website is clevelandtmjsleep.com. So that's Cleveland, Cleveland, like the city, tmjsleep.com. And you'll be able to go in there and actually schedule into our schedule.
I mean, this is perfect time to, you can have a virtual appointment. You don't even have to leave your house. So you can't use that you're busy or you're too tired as an excuse. And if for whatever reason you can't remember that, you can also access her website through her Instagram at Dr. Christina McGuire. I hope you guys learned as much as I did from this. This is so eye-opening. And now the next step is taking action, right? You now have awareness. You have, acknowledgement and validation. And what I love, facts and evidence. Now the rest is up to you. And I'm speaking to myself when I'm saying this, but the rest is up to you. So now what? Are you going to continue living with this way? Are you going to investigate at least that there perhaps is another way and a better way and a solution, and do it for yourself? I'm committing to it. I have to do it. I'm sold. I get it. And especially when you're talking about all the kid stuff. I mean, this was way back. This is my entire life. My entire life, I was like this. Like all these symptoms had GI issues. And that was like, when I was a kid, IBS was like a new thing. Okay. And I remember we had a lot of like family friends as doctors because the neighborhood we lived in, whatever. I mean, I was even rushed to the hospital. They thought I had like an obstruction, but it was like extreme IBS as a kid. So all these things are running through my head. I'm like, God, I really am the ideal patient, aren't I? Which I know you knew all along, but we're all stubborn. Well, thank you so much for coming on and sharing your time, your wisdom, your insight on all this and all the evidence and the medical information. This was amazing.
Thank you, Tiffany. It was my pleasure to be able to share with everybody.
Thank you. Talk to you soon.
Bye-bye.
If you enjoyed this podcast, please write a 5-star review on iTunes. Not only will this make me super happy, but it will allow more listeners to find our special show. Simply help me help others.